Good afternoon. Hope you all are doing well, and welcome to our final CPI session of 2025 for our San Joaquin Stanislaus Collaborative. I feel like this year has flown in some ways and in some ways has not. So, looking forward to closing out with our last session for 2025. Um, a few quick reminders that I'm sure you all are very familiar with. We do record these sessions, so we will share out the recording in our follow-up email that we typically send the following week after a session. And then for today's icebreaker question, we're doing it slightly different in that we'll be revisiting it later on in the session as well. But if you have immediate thoughts that you want to share, you can definitely drop those in the chat. But for a question that we're going to also revisit later on in the session is, as a CalAIM implementer, what is one instant moment or interaction you were most proud of this year? So we'll put that question in the chat, but we'll also talk about it a little more in depth later on. And then as always, encourage you all to use this as an opportunity to engage with one another, whether it's through chat or unmuting as you have questions. This is a great opportunity to learn from each other, as well as a great space for you all to ask questions to the MCPs, since we do have all of them on the line as well. So here's our agenda for today. So after welcome and level setting, we'll do some cross-sector policy and regional updates. So some statewide updates, as well as we have some new resources that we really want to share with you all that can support in your work. And we'll also hold space for our MCPs to share updates. And then probably I think what I'm most excited for today is our 2025 reflections. So we are going to do our quarterly survey, which some of you may remember we did during our August in person. This is a great opportunity to hear from you all on your feedback on certain areas of work. And then we'll also do regional successes. So I did share out a request to everyone if they wanted to present on successes. So we do have a few providers that sent some successes over that they'll share during the session. And then we'll also get the opportunity to hear from you all on what you're proud of or would like to celebrate from 2025. And then we'll close out with doing some planning for 2026. So, kind of sharing our vision for next year and kind of how we're hoping to run things, as well as getting your feedback on what would be most helpful as we think about next year, as it's the last year of PATH. And then we'll do a quick preview of kind of Q1 of events. So for our objectives for today's session, we want to highlight organizational achievements in delivering ECM and community support services in the San Joaquin and Stanislaus region. We'll receive MCP updates as well as share regional highlights and announcements, and then we'll engage in discussion to set 2026 collaborative goals. So with that, we'll move on to our policy and regional updates. So the first update that we wanted to share was around Cited, which is recently DHCS did announce Cited Round 4 awardees. So they awarded 145 million to quite a few providers throughout California, which, as a reminder, Cited is a funding opportunity to support providers in helping to build up their infrastructure and capacity to deliver CalAIM services. So here, just spotlighting the providers that were awarded Cited funds in San Joaquin County and Stanislaus County. I know some of these providers are actively engaged in the collaborative, as well as some that I think maybe not as familiar with that we'll hope to engage in 2026 as well. Did want to share a reminder around transitional rent. I know we've spent some time throughout this year talking about transitional rent, and hopefully we'll have even more information to share as transitional rent is going live in January 26 for the behavioral health population of focus. So this is a reminder to folks that transitional rent is going live for a very specific population of focus. with eligibility criteria that they will have to meet to be eligible in the deck. We do have another slide included that we're not going to share here that has the more in-depth eligibility criteria. So I encourage you all to take a look at that. And as a reminder, when you are making referrals for transitional rent, those should be sent to the county. We have that information included in terms of phone numbers for San Joaquin County. They have a referral form that's going to be linked in the deck PDF. And then also just wanted to pause since I know we had talked about this with the health plans. If you all had anything additional that you wanted to highlight in terms of the go live, we'll just hold space for that, or you can also just address it in your updates later. Don't see anyone unmuting from the MCP, so I'll continue on. Another resource that we wanted to just highlight was Medi-Cal Connect, which is a new analytical solution that brings together data from multiple sources to strengthen coordination across the Medi-Cal program, identifying gaps in services and helping to understand the impact of these services on member outcomes. This tool is more so, I think we're sharing it for awareness since it is only available at this point to the health plans as well as behavioral health providers. But will be, I believe DHCS has plans to make this available to other providers in the healthcare delivery space at the end of next year. So sharing this as an FYI. If you would like to learn more, they do have a PDF guide as well as an FAQ on just how the tool works and how it could be beneficial. And then also wanted to share a new resource that we've created, which is a streamlining payments checklist. And I want to pass it to John at this point since he played a very critical role in helping to develop this resource.
Yeah, can you guys hear me first and foremost? I am having some technical difficulties on my end.
Yes, we can hear you.
Perfect. So this was developed some time ago. It's intended as a practical tool for providers, managed care plans, and contract administrators to track payment readiness and claims invoicing for both enhanced care management, ECM, community support services. And I forgot to add that. So I forgot to add for CHWs. So whenever you're contracting with, your managed care plans, make sure that you understand your contract, your MOU that you do have with your managed care plans. So this will be available to everybody to utilize. A lot of this information I was able to gather from DHCS's website, and then also from my personal experience working with San Joaquin County and with Clinexus. It includes the following. There's a guide to prepayment setup. There's also guides to claims, invoicing, and payment processing. Special considerations for community supports and ECM services. There's also a checklist summary table that I put in there for you to be able to check off where you're at in the process for either contracting or being able to provide billable services. And then there's some other notes and tips that are added to this document. There's lots of great stuff there. It really does help you understand the whole process of what you're trying to do when providing these services to the most at need populations in our community. So if you have any questions, don't hesitate to reach out. I will be able to answer your questions in regards to this document in the future. Any questions right now? No? Well, thank you so much for the time, and I'll pass it back to Navneet.
Awesome. Thanks, John. And I believe Melissa did drop the link to that checklist if you all want to take a look. But it's a really great resource, and I know it's something we've been talking about revamping. Okay, so moving on, also wanted to share some additional resources that Health Begins has created through some of our other work around food as medicine. So we'll drop that link to this resource folder in the chat as well, but there's quite a few helpful resources in there, including a kind of one-pager / more information around SNAP and kind of what the impacts will be with some of the recent changes. as well as other resources that you might find helpful in your work. And then we also wanted to share a policy reminder from DHCS around uh, community support services. MCPs do have the opportunity once a calendar year to discontinue any community supports that they would like at that point. And changes regarding community supports do take effect on December 31st. So the reason why we did want to share this update was because some MCPs throughout California have elected to discontinue certain community supports. And if the MCP does decide to discontinue community support, they will be letting their providers know, as well as sharing a notice with any members that have been impacted at least 30 days in advance. Um, and did want to share from the health plans in our region, Kaiser and Health Plan of San Joaquin won't be discontinuing any community support services, but we did have an update with HealthNet. I'm sure all of the providers that are contracted with HealthNet have probably gotten notification already that they will no longer, starting January 1, 2026, be offering the community support service known as community or home transition services. HealthNet has shared that this change should not impact members, as skilled nursing facilities will continue to provide similar transition support services. So there's more information regarding this update that we can share in the chat as well. Um, and with that, I know there may be some questions, so I do want to pass it to Ileana if there are any additional context that you want to add around this, as well as pass it to you for just any general MCP updates as well.
Thank you. No, yeah, open to any questions that the audience may have around that update of community support services being offered as of 2026. I also have my email in the chat in case there's questions after the call. As it was mentioned, there should be no major impact. Some of these services are covered under skilled nursing facility services. Our providers were notified in October, so there has been some time for HealthNet to communicate that information to the providers and hopefully troubleshoot any questions that may have come up. But feel free to email me if there's any outstanding questions that I can support with. Great. And in regards to MCP updates, we're looking forward to uplifting transitional rent services. As we know, this is a service that's going live 1/1/2026. On behalf of HealthNet in Stanislaus County, we're currently contracted with Tracy Community Connections as our transitional rent provider. And we've began conversations with behavioral health department to ensure that we have a streamline for the referrals and the workflows in place. In San Joaquin County, the approach is a bit different. The services for transitional rent have been contracted to the county, to the behavioral health department, and they will be subcontracting some of the work to CVLIC, Central Valley Low Income Housing, to support with uplifting the service in San Joaquin County. Additionally, 2026 is going to be a busy year for, I think, a lot of the MCPs. We're also going to be uplifting Justice Involved and the rest of our county. So that's always something that keeps us busy. We continue conversations with all of our correctional facility partners for both adult and probation on a monthly basis. And that really is to support, again, the streamline of the referrals, ensuring that members are connected to our ECM providers and to have a successful transition back into the community. So we're continuing to uplift those services as we go into 2026. There's multiple deliverables that HealthNet and I think most of the managed care plans are working towards ending 2026. So definitely busy on our end, but definitely ask any questions that you may have about either other priorities that you're interested in for 2026. We're really excited to also see those providers that were awarded PATH-cited funding. And if you are a provider that was awarded and are interested in learning more from the MCP perspective around the network needs, definitely reach out to us. And I think on behalf of HealthNet, those are the major updates looking into closing the year here at HealthNet. Any questions? And Advait, I just wanted to say that I appreciate the information that's included in the slides around transitional rent. I know that on the full deck, I can see that there's the eligibility checklist and some of those more high level, I think, items that need to be noted for someone to be eligible for the transitional rent services. So as you read this after the call, or review the slide, and if you have any questions, again, feel free to reach out to us.
Thanks, Ileana. Okay, so if there aren't any questions for HealthNet, we'll go ahead and move on to Health Plan of San Joaquin. So I'll pass it to Niati for updates.
Hi, everybody. Happy December. I know everyone's very, very busy getting ready for the holidays. So thank you again for joining. Looking forward to starting 2026. A lot of movement, as Ileana shared. We're in the same bucket. We're going to be very busy with justice involved. We are still going to be going live with a San Joaquin County probation, as well as Stanislaus Sheriff and Probation. So we're all hands on deck next year, specifically getting the correctional facilities ready to go. And speaking of that, for those that do work in the correctional facility setting, I believe there is some staff from correctional facility. Just a friendly reminder that DHCS is going to have a really informative webinar this Wednesday. It's really taking a deeper dive into the readiness assessment. So this would be really, really important for correctional facility leadership and staff that are working on readiness assessment to join this webinar. I believe it's Wednesday the 17th from 11 to 12. So hopefully your leadership can share that invitation. Also, Health Plan San Joaquin, we're going to be going live with closed loop referral sometime early Q1. You should be hearing updates along with the provider alert soon enough, because that is going to encompass provider training and some updates. As of transitional rent, that is another implementation that we're getting very close to going live with. Again, we are only going to go live with the behavioral health population of Focus 1. So that's population of Focus 1. And just a friendly reminder that there's certain eligibility and social criteria involved when submitting these referrals. So I know sometimes a lot of people just submit referrals, but there are specific requirements, and Health Plan of San Joaquin has added their referral form and some additional information into the CalAIM websites, into our CalAIM website, and I'll drop that link momentarily. Again, we're working very closely with the county as well as transitional rent providers. So San Joaquin County is our transitional rent provider is going to be San Joaquin County Behavioral Health. We're very close to contract execution, but we're working on a weekly basis with them. For Stanislaus County, we have two contracted providers. That is Tracy Community Connections and Turning Point. So both have been executed. So we welcome them aboard as our TR provider. And just a friendly, since we don't know the utilization impact for transitional rent, we're going to kind of take it slow and keep our network small at this time. So just wanted to give folks a heads up that, right now the TR network, transitional rent network for Health Plan of San Joaquin is going to remain, a little small cohort right now as we kind of watch the utilization and how this transpires. So thank you once again. Happy holidays, happy new year, and looking forward to continued partnership next year. Thank you.
Awesome, thank you. So now I'll pass it to Kat from Kaiser for their updates.
Good evening, everyone. I am actually going to see with my colleague if she has an update for transitional rent before I jump into our monthly updates. Stephanie, do you have anything to share?
Hi, yeah, my name is Stephanie Shushan. I'm a project manager supporting transitional rent. So just wanted to echo exactly what our MCP partners were saying about transitional rent. Definitely highlighting that, this initial launch for January 1 is just for the behavioral health population that really does have really specific criteria. Also wanted to echo that there is a requirement, in the authorization process for us to guarantee that the individual has sustainable funding for transitional rent after transitional rent ends. So that's one thing that we're looking at very closely, and as really one of the requirements that we're looking at for authorization as we develop our processes and roll out this first population of focus. And we are working on finalizing our referral form as well. We'll be contracted with San Joaquin County Behavioral Health as our TR provider. And then in Stanislaus, we are contracting in the process of having Turning Point be our contracted provider for transitional rent.
Thank you, Stephanie, for providing the update on transitional rent. Stephanie, next slide, please. I am going to actually start with a member story, success story for Northern California. We do have Thomas. We actually just modified the name so it doesn't actually present the real member who shared the story. Thomas actually met with our community support team that for health and navigation. He was experiencing health challenges related to recent heart attack. He was experiencing periodic falls, and he needed support obtaining diabetic test strips. Additionally, Thomas lease was actually expiring, and he needed to find a place for him to stay with his family, but he did not have the financial means to secure new housing. So he actually he was able to connect with our care coordination team that actually connected him and his family to resources that including free food programs and utility payments assistance. And then he was actually connected with resources in the community that actually helped him with care management to support his medical needs. And Thomas actually was, had monthly check-ins, just making sure that the support that he needed was given to him. So this was quite a success story for us. Next slide, please. As you know, studies have shown that individuals with strong community network actually experience about 40% fewer mental health challenges. So this brings us to the next focus, which is mental health. Mental health actually are dynamic, and services may need adjustment over time. Kaiser Permanente actually provides mild to moderate mental health care under medical, which is non-specialty mental health services. At the same time, the county mental health offers intensive and substance use services. Both work together to ensure seamless transition with members that need additional support. The goal is to help members understand their full coverage and navigate access points for these services. Using feedback from previous discussion, as a medical member with Kaiser, we cover prevention care, screening, assessment, and treatment services for mild to moderate and mental health condition that may be provided to you even before you receive formal diagnosis from your mental health services. So we also have individual and group therapy. And then we have meetings that you can meet with your psychiatrist to discuss medication options and family support. and then receive medication that is not already covered under the medical RX contract drug list. And you can have ongoing medication appointment with your psychiatrist, and then imaging, lab, psychological testing when clinically indicated to evaluate any mental health condition. I am actually going to add a link to the chat after my presentation. Next slide, please. We do also have these resource flyers that I have provided to the facilitators. They're going to be sharing it with the community so that you can see where the resources are. You can tap into those resources for help. And Kaiser is actually working to try to minimize the stigmatization of mental health, so members can actually use this flyer to get the help that they need. Next slide, please. As you see, we've seen how mental health depends on access to resources. Transportation is another critical resource. Without it, even the best mental health services remain out of reach. So I am really pleased to announce our new platform that Kaiser had actually developed, the mobile platform where our members can actually schedule rides, cancel appointments, or even communicate with the rights providers. So this is the link. There is actually the link below that where you can, I'm going to actually share this link in the chat as well, where you can click and then sign up with your smartphone and all to actually access this portal. Next slide, please. Actually, this link actually works for both non-medical transportation and non-emergency transportation requests. So our members can actually use this to request rides, which you can definitely, schedule for your appointments, physician, dental, podiatrist, mental health provider, and all that. So this app, again, is one of the things that we are actually showcasing right now that is making it easy for our members. Next slide, please. So, well, this is just actually giving the differentiation between non-medical transportation as well as non-emergency medical transportation. So we see the difference. One is actually you can schedule the ride, and the non-medical transportation is you schedule the ride, the driver picks you up, and you can go for your treatment or doctor's visit. And this doesn't have to do with wheelchairs. And the next one, the non-emergency transportation, is actually a situation where there's wheelchair involved and you need to have authorization from your doctor to schedule the appointment. So this is just actually giving us the different level of transportation services. Next slide, please. I think that will be. So here is just the benefit of transportation, private as opposed to public transportation, bus or car, and from medical appointments to medical coverage and covered services. And it also talks about the services that is covered, transport to and from medical appointments, covered appointments to get medical services like labs and x-rays, and then transport to pick up medication, medication that cannot be mailed, for medical supplies and equipment. And then the non-emergency transportation, you're looking at ambulance, wheelchair van, or a gurney, and air transportation as well. And medical transportation for situations that are not covered under not emergencies are like basic life support ambulance, wheelchair vans, transportations, gurney, and air transportation. So again, it's just telling us that there's a difference between the NMT as well as the NEMT services. Next slide, please. Again, we are just telling our members that gas and mileage is reimbursable. So if you use your private car or somebody helps you to the doctor's office or Lyft or Uber, Kaiser is going to reimburse you for the mileage as well as the gas. Next slide, please. All right, I think that comes to the end of my presentation. Any link that was discussed, I'm going to put it in the chat. Thank you all so much. If there are any questions, please let me know. Back to you, Navneet.
Okay, cool. I don't think I see anyone with questions, so we'll go ahead and move on to the next section, which is our 2025 reflections. So we're going to actually start with doing our survey that we'll be doing through Zoom polls. So we have about 5 questions for you all where you'll have the opportunity to rank based on your experience just on each question. So I'll go through each one, and I don't know if we can also put them in the chat just for folks to have a sec to look over it, but I will voice them over as well. And we'll put them also activate the poll, and really appreciate if you all can participate in this. I promise we'll get it over quick and hopefully it's not too painful. Some of you all might recognize these questions as we do ask these on a quarterly basis. So the first question we have is around awareness of enhanced care management and community supports. So we'll ask you all to either agree or disagree with the following statement, which is my knowledge of ECM and community supports has increased due to my participation in this collaborative. So again, you can put your response in the chat, whatever that may be. And I will probably give it about 30 more seconds for folks to participate. And really appreciate you all doing this. You know, it's not the most fun thing to do. Okay, gonna give it 10 more seconds before we move on. Okay, I think we can go ahead and end that poll. And then I will move us along to the next question, which is around network growth. So we can put that poll up as well. And for this question, asking you all to rank on a scale of 1 to 5 how strongly you agree with the following statement, which is participating in the CPI collaborative has helped me expand my provider network within the CalAIM ecosystem. Thank you all for filling it out. Some people are really fast. I'll give it another 15 to 20 seconds for anyone else that would like to fill that out. Okay, I think we can go ahead and close that poll. I have a few more questions for you all. Okay, and then we can go ahead and put the next poll up, which is around efficacy. So the next question is around, is on a scale of 1 to 5, how confident are you in your ability to implement ECM and community support services? Give it another 30 seconds for folks to input their response. Okay, I think we can go ahead and end the poll. And I will move us to our second to last poll for this section. Okay, so the next question is around participant experience. So just asking you all on a scale of 1 to 5, how you would rate your overall experience as a participant in this CPI collaborative. Give it another 30 seconds before we close the poll. Okay, last chance to submit. All right, so now we're going to move on to our last question. Thank you all for your patience. This is around sustainability. So on a scale of 1 to 5, how confident are you that your organization will be able to sustain the progress made through the CPI collaborative beyond 2026 after PATH concludes? Give it 30 more seconds. Okay, I think we can go ahead and end that poll. All right. Thank you all for filling those out. It's very helpful for us. Okay, so now that we went through our impact survey, want to move on to celebrating our successes. So again, thank you for filling out that end of year survey. So as I mentioned, we had sent out an email to folks that wanted to share any successes with the collaborative. So we have a few providers that are going to share with us. So I'm going to first start off with Advantis Health Lodi Memorial. So if we have Madison on the call, I would love to open it up to you to share a little bit more about your org successes.
Hi.
Hi.
So like the slide says, we started our program this year. I was brought on in February and my coworker was brought on in May or June. June, she says. And so we have enrolled over 40 people in that time. We've had a big jump in the last couple of months due to some increased tabling events, and then we have been able to place 4 people in housing, and also start and finalize a housing deposits process. So we're still trying to build, but we've been able to make big strides in the time that we've been here.
Awesome. Thanks, Madison, for sharing. It's definitely great achievement and appreciate you all participating. So now I will pass it to John to share successes from Clinexus.
Good afternoon again, everybody. So I won't take any, what's the word I'm looking for? I didn't have nothing to do with any of this success with Clinexus at this time. I've been with them for a couple of months, but prior to that, I worked with San Joaquin County, and we were very successful with San Joaquin County. But at Clinexus, it looks like there's a process that we do. We call it the whole person care, as we utilize that type of terminology to be able to work with our clients. At this time, within the Central California in our ECM population, we have roughly about 6,000 members that we provide services to, and that's from San Joaquin County all the way to Monterey County. So during that time, We've had a 65% improvement in our avoidable hospital utilization, and that's the 30-day inpatient readmission versus the benchmark that was previously there. We also had a 75% depression scores reduced for behavioral mental health. The depression scores were actually reduced from a 5 to a 1.5. We utilize the PHQ-2 and the PHQ-9 when with our clients. We do that at different increments during the year to be able to see a reduction in their depression scores. And lastly but not least, we do as social determinants of health severity inquiry. We use the prepare, and based off the prepare scores, the severity reduced from 3 to 4 unmet needs to 1 to 2 within 6 months. So that was a 67% reduction. So those are the scores that we utilized in the last year for Clinexus. And we've engaged with about 25,000 members in the last year to be able to get these scores. So we're very excited to continue this and to further expand within the counties that we work in. So thankful for everybody on this call.
Awesome. Thanks, John. So we also wanted to hold space to, even though if you haven't shared anything that you wanted to share with the group, we did want to hold space for folks to be able to share their successes or moments that they're proud of. So I know when we first started, I had posed this question to the group. I think we had some folks already share their responses, but do want to hold space at this point as well to ask you all, as a CalAIM implementer, what is one instant moment or interaction you were most proud of this year? So you're welcome to share that in the chat, but also if you would like to unmute and share something with the group, I'm sure we would love that as well. Definitely your moment to brag about all the work that you all have been doing this year. So I know everyone's been working hard, so we can't have a quiet group during this section. Or we can sit in silence. Yes, would love to hear from you all if there's anything you would like to share.
Hi, Daphne. How are you?
Doing well. It's great to see you.
So I'll just speak in past of community support. I think it was great. I think with the implementations of the new policy guidelines that changed in April, it was a very hard transition this year. It was kind of, we didn't know that first month's rent was going to be something that got taken away, and it it did. With the policy changes that had came through, it was where we're going to still be able to help and assist the individuals. With that being said, our team was able to continuously still house, and they were able to house like over 300 individuals. And I thought that that was great. It has definitely been able to help people come out of shelters, to be able to get individuals to understand that change is definitely okay. And you just have to be able to understand and know how to work that system to still be able to create and, you know, understand how to get individuals to get housing goods. There's so much to brag about people that were not medically compliant. I think San Joaquin in general was able to work together collaboratively. It took everybody as a whole. If we weren't able to help somebody, to be able to push them off to somebody else. I worked great with Natasha's team, and Natasha's team was really great as far as like hand in hand. So I think everybody on here should have something to brag about, because it seems like CalAIM is finally fine-tooth combing all their policies and procedures, and we're able to all kind of piggyback off of one another.
Awesome. Thank you. That was, I think, summed it up really well about the work of this collaborative and how everyone works together so well. So do you want to hold space if other folks would like to share?
Hi,
Hi.
Nate. I'll share. I'm Carrie Grover from Tracy Community Connection Center, and I just wanted to share that. Oh, thank you very much. While we have had some challenging things going on this year, we actually learned and were able to create a lot of resources out of those challenges. So we went through an audit with Health Plan, and then we did our contract audit with Health Net and Health Plan in order to do our transitional rent contract. And both of those processes were challenging and time consuming, but created an opportunity to really streamline and like make sure we had all of our policies in place, that we um, were really on top of our everything, our forms were correct and all that. So I'm in a weird way grateful for those audits because it sort of forced us to get some stuff figured out, and we have just like exploded in the amount of services we've been able to provide, and so we're hiring new staff, and we're really excited about the opportunities going forward. So
That's awesome. Thank you, Carrie. Anyone else, either in the chat or would like to unmute and share? See, Ileana, you're also off mute, so I'll pass it to you.
Yeah, no, Carrie, I will take that comment back to our teams in regards to the audits and just, preparing our providers to ensure that, you're successful day one, right, on standing up the services. So thank you so much for that. And I just wanted to share my gratitude to obviously everyone here on this call. I think that the work that we're doing is not easy, right? But we are such a strong team here in Stanislaus and San Joaquin, this region particularly. We work really well together. I want to say thank you to the CBOs, to the community-based organizations, to the hospitals, to every single person that's doing the work on the ground. Really appreciative to everything from your emails to your questions to lifting some very important concerns. Josephine, I hear you when you say, the changes that are coming and how we have to be nimble and be flexible around that. It's definitely, it takes courage and it takes support. And I think this space really creates that for us. I also want to say thank you to my plant partners. This work cannot be done when we work in silos. And I think that for the 3 plans that are within these 2 counties, we've done a really good job at working together wherever we can. And I think it really shows. I always say, I think I see my plant partners more often than I see my own team members here at HealthNet. And so I just wanted to say thank you. And thank you all again for always allowing that opportunity and the space for us to come answer questions, raise questions, take back questions. And I look forward to 2026 and continuing that same effort and that same energy I think that it takes to do this work. So thank you all and happy holidays.
Awesome. Thanks, Ileana. I see Anthony also put a comment in the chat thanking the Health Plan of San Joaquin clinical team. So we'll definitely pass that along, but I know they're on the call as well. Anyone else before we move on that wanted to share anything? Okay, appreciate you all engaging with that. It's really great to hear everyone's successes as we close out the year. And I think we're going to now move on to our last section of today, which is looking forward to 2026. So I'll pass it to Melissa at this point.
Thank you, Navneet. So as you guys know, this is the last session of the year, and we do have one more year ahead of us, and then we are planning on closing out the CPIs. So we are looking for a little bit of feedback from you guys, and I have some information for you that'll give you a picture of what to expect in the new year, but also want to hear from you guys in terms of what would be most helpful as we think about sustainability. Next slide, please. So as a commitment to you guys, and if you are in other collaboratives, you might have already seen this a little bit, but what's staying in 2026? So we are still committed to hosting 1 monthly session per month. The minimum for us is about 60 minutes. I know for some sessions we've had them about an hour and a half, and we've also hosted office hours. We are going to be phasing out office hours with the small caveat that, we'll be replacing that with something else. You'll still get statewide policy updates. We'll do the monthly regional newsletters that you guys receive in your inboxes with session updates and any links that we collect throughout the months. And then we'll continue to teach and coach and develop tools or resources for participants on quality improvement and process improvement regarding CalAIM implementation. including business processes, workflows, data use, and sustainability. And then we'll continue to promote awareness of DHCS educational and knowledge sharing activities. So any webinars that you guys hear about typically during the sessions, anything for funding opportunities that are related to CalAIM or an extension of that. So that will all stay here. What's new? So I know we've talked about sustainability and we had originally stated a few different domains. We are going to be moving into a more simplified version of the domain. So we'll be focusing on workforce, services, data and measurement, payment and funding, leadership and governance, and consumer participation. So these domains are kind of predictive of a strong ecosystem. And so we are focusing on this, and you'll see this across all of the collaboratives. So this isn't going to change if you are joining other collaboratives. The only distinction is that there are some collaboratives that may, based on their regional needs, focus more on workforce, services, data and measurement, or so forth. So you can expect to see a little bit of distinction there, but there also is a push from DHCS and our funders for us to work actually more collaboratively with some of the external or other collaboratives across the state. So you might also see other collaboratives joining or other facilitators joining kind of some of these sessions and things like that. I want to pause here because I think, Bob, you asked about what happens with CalAIM. So with regard to CalAIM, the only thing that's currently changing is the PATH CPIs. So the CPIs will end after 2026. The state is submitting that renewal. And so depending on what CMS does with that renewal, then we'll have more updates about CalAIM specifically. And so the news that I have right now is more about just what's staying for the PATH CPIs. And we'll continue to give you guys information on, CMS renewal and what that looks like and any information that DHCS shares with us as well. We'll go to the next slide, please. So based on what's staying, we are wanting to see from you guys what, you want to kind of keep in the sessions and then what we want to kind of adjust. So we are looking at our 2026 roadmap and want to make sure that this is really meeting the needs that you guys are looking to meet, from the next year coming up. So I'm going to kind of walk through some of the different session types that we've thought through just based on what we've heard during previous sessions, what other facilitators are doing, and then what we're just thinking of when it comes to really supporting sustainability. So one of the things I'll start first with is the general session. So as I mentioned, those will stay the same. We'll try to continue that same format of monthly sessions, integrating sustainability topics as a key driver of conversations. But this doesn't necessarily focus on developing skills. The audience for this is all team members of a prospective or currently contracted ECM or community supports provider. But again, those are very general sessions. So we are thinking of preserving a few of those general sessions, however, phasing out this piece of having them as monthly general sessions. Some of the other things that we are thinking of offering are topical trainings. So this includes trainings on identifying drivers of sustainability, as well as domains of a sustainable ecosystem, which is what I shared in that previous slide. The audience here is all team members of a prospective or currently contracted ECM or CS provider. So that doesn't necessarily change. There's also the leadership session. So this one is a little bit different. This is more focused on strategy, alignment, decision-making, accountability, and organization or direction setting. This may meet some of those questions, Bob, that you just noted, what happens with CalAIM thereafter. And really the audience here is C-suite or prospective or currently contracted ECM or community supports providers. So those individuals who are really making the decisions for their organizations strategically regarding, how they want CalAIM to support their organization long term. We also have cross-regional topical training. So I alluded to this a little bit, but essentially our co-facilitators in other regions are considering doing topical trainings around sustainability, identifying drivers of sustainability, and then really talking about the ecosystem. So this includes all team members of a prospective or currently contracted ECM or CS provider across regions beyond this one. So you might have already seen us do this a little bit where we do cross-regional topical trainings with the Northeast region, which is Lassen, Modoc, Shasta, Trinity, and Siskiyou, And that's another region that Health Begins currently facilitates. But this may look like us working with, Fresno County or other regions kind of proximal to San Joaquin and Stanislaus. So I am going to ask everyone to please participate here so that we can, develop our 2026 roadmap. Navneet is going to pull up a poll essentially asking you guys to rank these sessions from most helpful to least helpful for you or your organization. So we have different options. There's extremely helpful, moderately helpful, slightly helpful, and not at all helpful. So if you guys can just take a couple seconds to go in, look at these different options and pick, which ones are most helpful for you or not helpful at all, not something that you're super interested in seeing in the new year. And we won't make a decision today, so we will take these ranked kind of areas and then determine what our roadmap will be. And we'll share that in January once we have kind of finalized this. I'm seeing really good participation, so I'll kind of wait till we get about 60 to 70% participation. Also, if you guys have questions, please go ahead and unmute, or if you have any immediate reflections, it would be awesome to hear from you guys. I'll do a 10-second final call. Okay, Nevni, I think we can close that. All right, let me see. I'm trying to see if I can read this appropriately, but it looks like topical trainings and then leadership sessions. Cross-regional, I think looks like the lower end. And then general sessions, I think it's a pretty even split. Okay, that's super helpful. Thank you guys for that. We'll go ahead and move to the next slide. And I know we have a quiet group today, so I welcome you guys to use the chat if you would like to. But just trying to get another source of kind of data here. And so curious to hear from you guys. What are your top priorities or key goals for your ECM and CS supports implementation in 2026? And then the second question there is how can we as a collaborative deliver the most value for our final year of PATH CPI? This will also inform, some of those topical trainings or leadership sessions. So if you have any thoughts, feel free to unmute or you can go ahead and use the chat as well. Maybe I'll pick on John if he's still here since he's at Clinexus now.
Yeah, I think for this year, some of the areas we definitely want to get into is the rural areas within different counties. As you all know, there's going to be a lot more federal funding that's going to be provided to rural areas throughout the state. So that's where we're going to go start looking into is providing more services, be more impactful, provide more information in those rural areas, even though we know from the get-go that these are the areas that are going to be probably the hardest hit and a lack of information getting to those areas. So 3 years in, we're going to start getting into those areas. We've been very successful in cities and populated areas, but the rural areas is where we're going to be looking for in 2026. So you'll be seeing us out there.
Thank you, John. I see Susan put 2 comments in the chat. And Susan, we actually have a financial sustainability kind of focused office hour. Would you like to come off mute and talk about that a little bit in terms of what you're looking for? No worries. You can also use the chat if you want to provide any additional context. Tiara, more direct referral pipeline between agencies under CalAIM, as well as better communication with MCPs and enrolled members. Okay, and Bob looking to contract with HPSJ and HealthNet. All right. Okay, next slide, please. And welcome you guys to continue sending us messages as things come up for you. So what's next? As I mentioned, we do have our sessions already scheduled. We haven't defined the meeting types or topics, so you'll see that some of that does say TBD. But for those of you who are planning ahead and or are working with other collaboratives, we are having a general session in January. So we'll talk about our roadmap there. And then in February, we do have a scheduled session there. We just don't have the topics or kind of meeting type quite yet. And then in March, I know a lot of you guys really love to do the in-person, so we are having an in-person in March. The first one will be in San Joaquin County, and we'll determine the actual location a little bit closer to that date. And Bob, yes, we would love to hear about venues for the in-person, so we'll reach out to you there. But that is scheduled for Thursday, March 12th. And again, that is depending if we find a venue for that day. So just want to note that this date may be subject to change, but we're hoping to have it that date. Next slide, please. And then in terms of next steps, so I mentioned we do have a January session. That one will be January 26th. So we won't see you until the new year. That will be a 1 hour session. Again, we won't be hosting office hours. And then we still have our one-on-ones as available, but those are kind of ad hoc. Next slide, please. And as I had mentioned, we do have an office hours coming up later this week. So this is again our last office hours of the year. We will be focusing on financial sustainability, specifically tools to equip providers with practical tools and insights for maintaining continuity of care, including scenario planning exercises, development of provider guidance templates or case studies. And Navneet has just dropped that in the chat. We've also sent out a survey to see if you guys have any specific questions about that. That might be in your inboxes. I don't know, Navneet, if we have it readily available to drop it. But if you guys do have any questions, we also have one of our co-facilitators on the call right now, who can collect any questions that you have to be able to really tailor the content on Thursday. Thank you, Susan. And please let us know. You can also email us if you have any specific questions. That way we can integrate it. Next slide, please. And Navneet, I think I took over your slides, but I'm just going to go with it. Okay, that was it. Thank you guys so much. I hope you all have a really happy new year. If you celebrate the holidays, I hope you have a Merry Christmas, Happy Hanukkah. I don't know which other ones I'm missing, but I hope you guys have an amazing end of the year and get tons of rest. Thank you so much for joining us.
Thanks,
Thank you,
everyone.
everyone.
Happy holidays.
Yes.
Happy holidays.
Bye.
Bye.
See you all on Thursday for whoever's
Thursday it is.
Bye.